of Usapang Insurance. I'm Laarni Tagalog. I'm an independent insurance advisor helping you understand your insurance better. And today's episode, pag-uusapan po natin ang tungkol sa private health insurance here in New Zealand, no? Or medical insurance. I get a lot of question asking if kailangan ba talaga ang private health insurance when libre naman ang public healthcare sa New Zealand. So that's a very, very common comment or question that I get, and you probably have heard them yourselves or get asked with the same question yourself. So let's tackle all that ngayon, and hopefully all your questions will be covered in this video. So first of all, that's a fact. It's a free public healthcare system in New Zealand. So long as your visa is 2 years and above, work visa, then automatically you are eligible for the public healthcare. So if you are eligible for the public healthcare, so bakit pa kailangan ng private health insurance? So first of all, in the public healthcare system, they have this what you call public wait list. Okay, so I will give a scenario. If, for example, you will need a surgery and your case is not urgent, then you will be put in this so-called public wait list. Okay, and they will do the scheduling or get a procedure done, a surgery done according to its urgency. So kung yung kaso mo ay hindi masyadong urgent, no, hindi mo kailangan agad surgery, then you will be waiting. Now, you could be waiting for, it depends, a few months, or some are actually been waiting for a year kasi nga hindi ganoon ka-urgent yung case, okay? But then again, if you have a private health insurance, then it bypasses that waiting list because you can just go to a private hospital, get it booked, and magagawa siya, okay? And a lot of people have already considered getting a private health insurance for that very reason. Kasi hindi naman kasi ibig sabihin that it's not urgent or they labeled that as not urgent. It doesn't mean that you are not affected by that condition, no? Kung hindi siya na surgery agad, kung hindi nagawa yung surgery, it could be that it's affecting how you work or it's affecting your income kasi nga madalas kang nag-absent kasi may dinadamdam ka na symptoms or whatever it is. So a lot of people just put a really good investment and just get a private health insurance and have that peace of mind that if they ever need a surgery, then they can get it done the soonest possible, no? So, and that is the same way as private specialist consultation, no? If in-refer ka sa specialista, if you need a diagnostic test, MRI, CT scan, ultrasound, whatever diagnostic test, you will always get into this public wait list. And again, depending on urgency, again, mag-aantay ka. And same thing, if you have private health insurance, then you do not have to wait. You can get it done privately. So that's the very first importance of private health insurance. It bypasses that waiting list, and then mapapagawa yung consultation mo or diagnostic test or surgery, and even cancer treatment, no? That is part of depending on which company, what type of cover, no? May mga private health insurance that are very comprehensive yung cover. So that's something you can discuss with an advisor for you to be guided kung anong klaseng cover ang kukunin mo, no? Some are very comprehensive, like what I just mentioned, no? They've got all these surgery, cancer treatment, specialists, and tests. Yung iba pa may mga add-ons, no? Dental, optical, or GP consultation, yung mga physio, yung mga ganon. So those are some of the options that you can get or you can discuss with an advisor, but you will be guided accordingly. And as I always already discourage and in my videos and my live videos, no, don't DIY your insurance. Always go through an insurance advisor para mag-guide kayo when you are planning to get a medical insurance. Kasi ang dami talagang clause or maraming mga policy wordings that you thought you're covered. If binili mo lang siya online, you might not actually know that those things are actually not covered. And here comes claim time, nag-claim ka, surprise, surprise, hindi pala siya covered. And you could have been paying for this policy for a few years and then you're just gonna get surprised one day, hindi pala cover yung mangyayari sa'yo, yung nangyari sa'yo. So it's good to not have that wrong expectation. So it's good to set that things correctly from the very beginning, so you know what you are paying for, what type of cover, ano yung mga benefits included. Okay, so that's the first one. It bypasses the waiting list. Second benefits I can talk about is there is what you called non-PHARMAC benefits sa medical insurance. Okay, and again, I'm not generalizing, depende yung kung anong cover, kung anong saang company, okay? But some medical covers, they have this non-PHARMAC benefits. May mga gamot sa New Zealand that are government funded, but there are also medications that are not government funded. So if yung gamot is hindi funded, I can think of an example, like some cancer drugs have found to be very effective, but it's non-government funded. Covered ito in some medical insurance, okay? And again, depende kung saan company, depende what type of cover. Some non-PHARMAC benefits, o yung mga gamot na hindi funded, can get you covered from $500,000 to $600,000, okay? And depende, okay? May iba naman, it's not that comprehensive, $10,000 lang yung cover per year. So depende talaga. So these are the things that you have to discuss again with an advisor of how much non-PHARMAC benefit you have in this cover. So that is again a very, very good benefit, right? Kasi nga, again, if our health fails along the way, it's just good to have that peace of mind that whatever happens in your health, you can get the best treatment, whether this is funded or non-funded. You can afford, no? Imagine if you have that comprehensive cover which covers non-PHARMAC or mga gamot na hindi funded, $500,000 to $600,000 a year. That's a very decent amount, no? So parang you get this flexibility, you can get the best treatment. It's a peace of mind, no? Mahal. Mahal ang peace of mind. Mahal ang peace of mind. So tama ba yung pinagsasabi ko? What I'm trying to say is, yes, you gotta pay for that peace of mind, which again, you can't really put a cost in that peace of mind, no? Like I always say this, if you have already sit down with me with an appointment, I always say this, like we are all healthy and that's why we are able to work at the moment and provide for our family. But have we actually put a protection or an investment for our health if along the way our health fails, no? Makakapagpagamot ba tayo kagad? Are we gonna get the best treatment? Do we have all these options for treatment? No, if you have a really good comprehensive medical insurance, then yes, you have put the right investment for your health. Because as they say, and as cliche as it may sound, health is wealth, but it is really health is wealth. No, kasi parang if you're sick already, then that's it. You can't work, you can't provide for your family, and that's just the end of it. Okay, so it's really, really good. And some might think, okay, it must be so expensive. I mean, there's always a way. Talk to an advisor so you're going to get through. If like us advisors, we go through with you, we check your affordability and work on your budget to be able to get that cover that you want within that budget frame. No, we can guide you through prioritized cover, which is more important for you and for your family based on your circumstances. We're gonna go through all that with you, and you cannot have that guidance and advice if you're just gonna buy a policy online. Okay, so those are the two things that I can think of like very, very major benefits of private health insurance. And of course, there's a lot more built-in benefits in some like especially for comprehensive private health insurance, ang daming built-in benefits and all that. And you're gonna get through that with an advisor. The advisor can go through with you and all that kasi depende din kung saan company and what type of policy, what type of cover. So I hope that answer all your questions about private health insurance. Is it really needed? Well, yes and no. So it really depends on your priorities. It goes back to your priorities. Is your priority is getting the right treatment as soon as possible? If you get sick, then yes, private health insurance is for you. So I hope that answers again all your questions, and I'm always happy to answer questions. Follow my Facebook page, follow my Instagram page, leave me a message. or even email me. I will be happily to sit down with you and discuss your options and answer your questions. Even if you can just PM or DM me on Instagram, I'll be happy answering your questions. So until then, I hope that helps, and I'll see you in my next video.